Dang, I've been putting on so much weight lately.
So much weight lately, you say?
Yeah, how'd you know?
I happen to be a doctor. By any chance have you been experiencing extreme hunger, extreme thirst? Here you go, by the way. Frequent urination, blurred vision, or tolerance to pain almost?
Yeah, like so much.
Just as I suspected. This man has type 2 diabetes.
Hi, I'm Dr. Driver. I'm here to help you with your medicines for type 2 diabetes. Metformin is an oral diabetes medicine that helps you control blood sugar levels. Metformin is used to improve sugar control in people with type 2 diabetes. It is sometimes used in combination with insulin or other medications, but this medicine is not for treating type 1 diabetes. The intentional dose is 500 milligrams orally twice a day, or 850 milligrams orally once a day. The extended release dose is 500 to 2,000 milligrams orally once a day. Commonly reported side effects for metformin include lactic acidosis, diarrhea, nausea, vomiting, and flatosis. This is an oral diabetes medicine that helps control blood sugar levels. Actos is for people with type 2 diabetes. The recommendation starting dose for patients without congestive heart failure is 15 milligrams or 30 milligrams once daily. Common side effects of Actos include upper respiratory tract infection, edema, and hypoglycemia. Diabetes medicine that helps control blood sugar levels. It works by regulating the levels of insulin your body produces after eating. The recommendation dose for Januvia is 100 milligrams once daily. Common side effects include body aches or pain, cough, and difficulty with breathing.
Hi, it's Dr. Armstrong again.
Hi, it's Dr. Jarvis again.
Now, if you have type 2 diabetes, you most likely know that you're going to develop diabetic hyperglycemic hyperosmolar syndrome, or HHS, within your endocrine, excretory, and digestive systems. Now, diabetic hyperglycemic hyperosmolar syndrome involves very high blood glucose levels without ketones. Now, the circulatory system. High blood glucose levels can contribute to the formation of fatty deposits in the blood vessel walls. Over time, that can restrict blood flow and increase the risk of hardening of the blood vessels, which also causes clots. People with diabetes are also particularly prone to foot problems due to narrow blood vessels in the foot and leg.
Diabetes raises your risk of developing high blood sugar, putting strain on the heart.
Now for the integumentary system.
Diabetes can affect your skin. Lack of moisture can cause the skin on your feet to dry or crack.
Very true. You may also be prone to boils, infection of the hair follicles, styes, and infected nails. People with diabetes have a higher risk of bacterial infections as well. A condition called diabetic dermopathy can cause brown patches on the skin in some cases even.
Alright, back onto the central nervous system.
Diabetes causes damage to the nerves, which can affect your perception of heat, cold, and pain, making you much more susceptible to injury, as you do not know when you are hot, cold, or in pain.
People with diabetes tend to develop cataracts at an early age than other people.
But now for the reproductive system.
The hormones of pregnancy can cause gestational diabetes. Women with gestational diabetes may have babies with higher birth weight, making delivery more complicated. Heck yeah.
Women who have had gestational diabetes should be monitored, as there's a much increased risk of developing diabetes within 10 years.
Tab, you're it. Whoa! Are you okay?
No.
You know, she just fell because she's too fat to run. Another patient with type 2 diabetes, it's spreading. Did that fall happen to hurt at all?
No.
Just as I suspected. Another common sign of type 2 diabetes, not feeling pain. Hi, I'm a nutritionist, Dr. Armstrong. Now before I begin, I would like to say that type 2 diabetes cannot actually spread, as I had said before, for comedic effect. I think we can all agree it was quite hilarious.
That was really funny.
Yes. So, as a nutritionist, I advise on matters of food and nutrition impacts on the health. I help diabetics a lot since their diet is one of the most important aspects of their life after they contract type 2 diabetes. I find foods that diabetics can eat and create a meal plan based on those foods. I can also help you prevent and treat illnesses by promoting healthy eating habits, and I may also suggest diet modifications to suit your needs having type 2 diabetes.
Baleigh from the American Diabetes Association. For exercise, we recommend a lot of aerobic exercise because aerobic exercise helps your body use insulin better. It makes your heart and bones strong, relieves stress, improves blood circulation, and reduces your risk for heart disease by lowering blood glucose and blood pressure, improving cholesterol levels. The American Diabetes Association recommends aiming for 30 minutes of moderate to vigorous intensity aerobic exercise at least 5 days a week, or a total of 150 minutes per week. They say to spread your activity out over at least 3 days during the week and try not to go more than 2 days in a row without exercising. I'm a primary care physician. Primary care physicians are important for diabetics because they will help analyze records, reports, and test results. They will be the ones who will discuss test results or prescribe treatments with patients.
Here's the meal plan that the two of us have devised for you.
Thank you so much.
We hope you enjoy. Here's your meal plan that the two of us have devised
Oh,
for
thank
you.
you so much.
Restart it.
That's for pregnancy.
Oh my god. Metformin is an oral diabetes medicine. Colin! Oh my god.
My urination.